you know that nearly 500,000 tonsillectomies are performed every year in the U.S. alone? It's astonishing, really. For something so routine, so commonplace, you'd think we'd have it all figured out. But here's the kicker. Many experts argue that this common surgery is not only unnecessary in most cases, but can also lead to serious complications. Think about that for a moment. Children are whisked into operating rooms, their tonsils removed under the guise of health, yet many are left with complications that can linger for years. Pain, bleeding, even infections can follow. And why? Because of a few sore throats or snoring at night. We need to question the narrative that tonsillectomies are a catch-all solution. It's time to expose the truth behind this procedure and encourage a more thoughtful approach to our health. Before you agree to surgery, ask yourself, is this truly the best option? Tonsils, those small glands nestled at the back of our throats, have long been misunderstood. Once heralded as the unsung heroes of our immune systems, especially in childhood, they were thought to ward off infections. But as the 20th century rolled in, the narrative shifted dramatically. The tonsillectomy became a rite of passage for countless children, a surgical solution to recurring throat infections. Doctors believed that by snipping away these tiny defenders, they could pave the way for better health. Yet, as research evolved, a different picture emerged. Modern science has revealed that antibiotics, improved hygiene, and simple lifestyle adjustments, dietary changes can often tackle what tonsillectomies were meant to cure. Despite this knowledge, the surgery remains prevalent, sometimes performed with little more justification than tradition. It's a curious contradiction, removing a body's natural defense in the name of health, while the real answers lie in understanding and preserving what we already have. Why are tonsillectomies still so common? It's a question that should make us pause. The reality is, many healthcare systems seem to prioritize profit over patient well-being. Tonsillectomies are quick procedures that can generate substantial revenue for hospitals. It's almost like a conveyor belt. Patients come in with a sore throat, and before they know it, they're being ushered into surgery. But what about the alternatives? What about the options that don't involve a scalpel? There's a disconnect here, a troubling trend where the focus shifts from what's best for the patient to what's best for the bottom line. It's easy to overlook the long-term consequences when the immediate cash flow looks so appealing. So we must ask ourselves, are we really considering the health of those we treat, or are we simply perpetuating a cycle of unnecessary procedures? It's time to rethink our priorities in healthcare. Now, let's talk about the risks. A tonsillectomy is not as harmless as it seems. Complications can include severe bleeding, infection, and in rare cases, even death. Additionally, removing the tonsils can weaken your body's natural defenses against infections. It's easy to overlook these dangers when you're focused on the immediate relief of chronic sore throats or sleep apnea. But what about the long-term consequences? One study found that children who undergo tonsillectomies may have an increased risk of respiratory and immune-related illnesses later in life. Imagine a child who finally gets rid of those pesky tonsils, only to face a future riddled with health issues that could have been avoided. So, before you sign up for the procedure, ask yourself, is it really worth the risk? Weigh the benefits against potential complications. It's a decision that could impact not just your recovery, but your overall health for years to come. When tonsillectomy might be necessary. This is not just a matter of preference. It's about health. When your tonsils become the enemy, obstructing your airways at night, leaving you gasping for breath. That's when a tonsillectomy might be necessary. Imagine waking up exhausted, day after day, because your body can't find rest. Or consider the relentless cycle of chronic tonsillitis, where every swallow feels like a dagger, and every treatment fails to bring relief. In those moments, the decision becomes clear. Yet, it's alarming how many surgeries are performed without such grave necessity. The balance between risks and benefits tips precariously, often overshadowed by the allure of a quick fix. It's essential to weigh the implications, to understand that while surgery can be a lifeline for some, for many, it may just be an unnecessary gamble. We must advocate for thorough evaluations, ensuring that when the scalpel comes out, it's truly for the right reasons. Summary of what we have discussed. You know, it's easy to feel overwhelmed when faced with health decisions, especially when someone tells you surgery is the only way. But remember, your body is resilient. Those tonsils? They're not just there for decoration, they play a role in your immune system. Before you rush into anything, pause and explore your options. There are alternatives, treatments that can help you heal without the need for drastic measures. Trust your instincts. Seek advice from those who truly care about your well-being. You deserve to be informed, to weigh every possibility. So if you found this video helpful, share it, like it, and subscribe for more insights that empower you. And let's open up a conversation in the comments. Have you faced the tonsillectomy dilemma? What did you choose? Your story could inspire someone else to take charge of their health journey. Together, we can navigate this path with hope and strength.